Good evening, everyone. Very warm welcome to all of you at our conceptual brainstorm integrated session of anatomy. Here we are going to integrate this anatomy part with our pathology, with medicine, ENT, radiology. So one by one, we are going to start. Please inform me that audio, video, everything is okay. Okay. So what is our today's topic? We are going to talk about our stelloid apparatus. So this session is not only dedicated for the first profess students, but it is very important for the our NEET PG, INICET, FMG exam students, USMLE plab also. Okay. So we are going to start this session stelloid apparatus. First, one beautiful three-dimensional orientation. Can you observe the three-dimensional anatomy, the Iron Man anatomy, the Jarvis? Yes. We are going to observe in this our three-dimensional orientation the lateral view. Can you see? This is our temporal bone. Okay, sir. Temporal bone is having four parts. The flat squamous part. Here you can see the mastoid part, mastoid process, mastoid part. This is external auditory canal. The roof is formed by tympanic plate of the temporal bone, and inside you will see petrous part of temporal bone. So these are the four parts. Now you can see one elongated cylindrical projection from this our temporal bone. This is known as stelloid process. Agree? Along with this stelloid process, total 5 structures are attached: 3 muscles and 2 ligament. So stelloid process along with the attached structure known as stelloid apparatus. Why we are going to learn? Because in few people this stelloid process is too much elongated. Yes, integrating with your clinical radiology. Catch this point? Yes, look here. This is our mandible part. Okay. So can you see? Can you compare? Yes, this is the elongated projection. It is very, very excessively long. Fine. So when there is an excessive elongation within the neck part, sir, it will cause compression of the important structure in the neck. It is very close to the our carotid sheath, internal jugular vein, common carotid artery. So that's why we are going to learn about this topic. Yes. So catch this point, sir. We are going to learn from the basics. This is our stelloid process, correct, sir? And you can observe the ligament is attached, correct, sir? Stelloid process to the mandible. Break the name, get the idea. Stylomandibular ligament. We are going to learn about the our muscle from stelloid process to the hyoid. So this is the stylohyoid muscle. Always I told you, break the name and think about it. Stylo plus hyoid muscle means it is taking origin from the stelloid process and getting insertion into the hyoid bone. So it is stylohyoid muscle. Okay. Also you can observe the more and more things we will discuss, but this our stelloid process along with the attached structure, yes, it is known as our stelloid apparatus. Okay, sir. So first of all, for the first MBBS students, you have to define. So what is the definition? So you can write down, you can prepare the notes, sir. Definition. So what you have to remember, sir? Stelloid process is nothing. Yes, stelloid apparatus is nothing. Break the name and get the idea. Stelloid apparatus means your own stelloid process. No need to mug up. Just try to understand. Yes, sir. Stelloid process apparatus means more than one structure. So remember what is the apparatus? Sir, styloid process with its attached structure. Attached structures. Okay, sir. So you can use the word that, for example, styloid process along with its attached structures known as styloid apparatus. Agree? So this is the way how you can easily remember. Getting the point, everyone? Very easy. Fine. So catch this another point. What are the different structures attached to it? Yes, sir. What are the different structures? Sir, total 5 structures. Agree? So what are the different 5 structures? Remember, sir, there are our, yes, 3 muscles and 2 ligament. So what you have to remember, sir, there are our, yes, 3 muscles and 2 ligaments. Agree? So what are the 3 different muscles? One by one. Sir, first, it will take origin from the styloid process. That's why you will say stylo. Yes, sir. And it will go to the tongue. So what is the name? Styloglossus. Agree, beta? Aram se. Fine. Now look, the another one is taking origin from the styloid process. Okay, sir. And it is going to the hyoid bone. So what should be the name? Stylohyoid. Just break the name and think about it. मिर्जा गालिब कहते हैं सारे राज नाम में दफन रहते हैं. So styloid process origin and glossus is the insertion. Yes, styloid process is origin and glossus is insertion. Styloid process is origin and hyoid bone is insertion. Okay, glossus is the insertion, hyoid is the insertion. Now next, third one, sir, styloid process is origin, so you will use the word stylo and it will get insertion into the pharynx, so you will say pharyngeus. Yes, stylopharyngeus muscle. So it is origin and pharynx is insertion, just in a simple way, no need to mug up. ऐसा अक्सर कहा जाता है anatomy is very dry, hard, boring and volatile. We are just trying to make easy. कम से कम कुछ चीजें तो हो जो हम जिंदगी भर ना भूलें. Yes, sir. 3 muscles, styloid process to the tongue, styloglossus, styloid process to the hyoid, yes, stylohyoid, styloid process to the pharynx, stylopharyngeus. Can you remember? Just do imagination. I am coming close to you, sir. Do imagination. Tongue, okay, sir. Hyoid, okay, sir. And here in the our neck part, there is a pharynx. Agree, everyone? So styloid process to the tongue. Do with me. Styloid process to the tongue. Styloglossus, styloid process to the hyoid, stylohyoid, styloid process to the pharynx, stylopharynx. So easy. Styloglossus, stylohyoid, stylopharyngeus. So simple. Okay. Just looking like a wow. Anatomy is very beautiful. So elegant, so beautiful. Just looking like a wow. Okay. So I think there is a no need to get confusion. Just in your own body you have to learn. Okay. Yes, yes, yes. Hope you all are enjoying. Okay, people are getting old and you are getting young. What you eat, please? I eat my passion. Teaching is my passion. Okay, beta. So thank you, Asfan, for such kind of the positive lovely comment. Okay, so whenever I am teaching I get happy, and happiness is the antioxidant. So always be happy. Whatever the passion you are having, follow it. Okay, beta. So these are the points. Okay, what are the ligaments? Catch here, sir, there are the our 2 ligaments. So what are the 2 ligaments? First, the first is taking origin again from the styloid process to the hyoid. So this is stylohyoid. But you can see, sir, this stylohyoid was muscle also. But here you are talking about the stylohyoid ligament. Agree, beta? So this is our stylohyoid ligament. Now what is the another one? it will take origin from the styloid process and it will get attachment to the our mandible. So what should be the name? Stylomandibular ligament. Agree? So can you remember these slides? First we talked about our definition. Sir, in simple word, styloid process plus apparatus. Yes, styloid process along with its attached structure known as the styloid apparatus. Okay, sir. 5 structures are attached. Yes, sir. These are the your MCQs. What are the 3 muscles? What are the 2 muscles? Yes, these are the Q. We are covering the NEET PG INICT questions also. Okay. So 3 muscles: styloglossus, stylohyoid, stylopharyngeus, 2 ligament, stylohyoid ligament and stylomandibular ligament. यहाँ तक सबको याद हो गया बेटा? Fine. आगे बढ़े? Okay, sir. Now look further. Try to catch this another point. Sir, after this all, one diagrammatic presentation for all of you. चलो एक डायग्राम हम बनाते हैं. So catch this one, just one diagrammatic presentation. Remember, we all are not the painter. Fine. So don't expect that you will draw a very beautiful diagram. Yes, remember, you will not draw the beautiful diagram, but we are doctor. We will put the proper labeling, proper knowledge. And remember, that knowledge cannot be put by the painter. बेटा आप डॉक्टर हो, आप नॉलेज रिप्रेजेंट करोगे, आप पेंटर नहीं हो, तो खुद से एक्सपेक्ट ही मत करो कि आप बहुत अच्छा डायग्राम बनाओगे. लेकिन हाँ, इतना करना है, लेबलिंग सही रखनी है, क्लीन डायग्राम बनाना है. ओके सर. सो सपोज दिस इज द इलोंगेटेड bony projection styloid process. Okay, sir. This is our what? Sir, this is our styloid process. Okay. Now look here, sir. There is the presence of the tongue and then hyoid and below is pharynx. So one by one, sir. Here is the presence of the our tongue. Suppose this is the our muscular structure within the oral cavity. Sir, this is the tongue. Yes, always in my class I say that Hollywood, Bollywood, Tollywood all comes from the our anatomy. Do you know any song which is dedicated to the tongue? Yes. Can I sing the song for all of you? The song is तूने मारी एंट्रियां तो दिल में बजी घंटियां रे टंग 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 टंग. Yes, this song is dedicated to the tongue. Tongue is very important topic. Okay. Now look here, I'm just joking in between the class so that anatomy can be interesting. Okay beta? Okay, fine. Okay sir. Now below to this tongue there is the our bone. Which bone, sir? There is the our hyoid bone, which is having the laser cornu. Yes, body. And suppose this is the our greater cornu. Fine. So this is our which bone? Sir, this is the our hyoid bone. I'm just displacing this bone little bit lower so that we can understand the structures properly. Now this hyoid will continue with the our thyroid cartilage, cricoid cartilage and the trachea. Okay sir, here will be the our trachea, and behind this our hyoid and trachea part, sir, there will be the location of the, yes, pharynx. So one simple diagrammatic presentation. Suppose this is our pharynx part. What I want to tell you, sir, here is our hyoid bone. Okay sir. And suppose this is our what, sir? Pharynx. Agree beta? Fine. Now what I want to tell you, sir, the first muscle we are going to talk about our styloglossus muscle. Now catch this one, the styloglossus muscle. As the name is suggesting, this will take origin from the styloid process and it will take insertion into the tongue. इतना जरूर याद रखना है, और इसको याद रखने के लिए कोई मेहनत करने की जरूरत नहीं. इतना बच्चा बच्चा बता सकता है, सर, styloglossus, styloid process origin, then tongue is insertion. But little bit more points for all of you. Sir, try to catch this point. Yes, we are going to talk about the our styloid process. The muscle will take origin from the anterior surface of the styloid process. Okay, sir. Fine. So it is taking and it is getting insertion on the side of the tongue. Yes. Simple. Okay, getting the point? So what is the name of this muscle? Sir, this is our styloglossus. What I want to tell you, sir, this is our what? Styloglossus. glossus muscle. Fine. Now look here, I am writing here the few points for all of you. Sir, origin, okay sir. Sir, insertion, correct sir. Sir, the action and nerve supply. I am writing the nerve supply first and then action. So you can remember OINA. Every muscle for the first MBBS students, you must know the origin, insertion, nerve supply, action. Okay, sir. So styloglossus muscle origin. Sir, it is taking origin from the anterior surface of styloid process. Agree everyone? Yes. Where it is getting insertion? Sir, it is getting insertion at the side portion of the tongue. Yes, sir. Where it is getting insertion? Yes, on side of tongue. Now try to understand what is the action. I told you, jidhar muscle, udhar movement. Where muscle goes, their movement flows. So this muscle is coming from the our styloid process, getting insertion into the tongue. So when this muscle will contract, yes, it will pull the tongue on the back side. So what you have to remember, sir, it will pull the tongue at the back side. Okay. So what you have to catch, sir, this is contracting and it is pulling backside the tongue. You know, forward movement is known as the protraction, backward movement is known as retraction. Sir, it is responsible for the retraction of the tongue. Now nerve supply, try to catch this styloglossus means tongue. Okay, so it is the muscle of the tongue. Do you know all the muscles of the tongue, they are derivative of the occipital myotome or occipital somites? Yes, we had seen in our pharyngeal apparatus part. And the nerve of this our occipital area myotomes, sir, that is our, yes, 12th cranial nerve. So remember, it is supplied by which cranial nerve? 12th cranial nerve. MCQ. Yes, sir, it is supplied by our 12th cranial nerve. Agree, beta? Fine. Hope you all are getting the point. Okay. So after this one, yes, catch this point. One another point. All the muscles of the tongue, they are derivative of the our, yes, occipital myotomes, except, yes, palatoglossus. The name is suggesting palato, means it is attached to the palate also. And the nerve supply of the palate, yes sir, your answer is the vagus nerve. Better answer is the vagoaccessory complex, and the best answer is the pharyngeal plexus. Okay, fine. Okay, sir. So just one additional point I told you here. These are the points about the styloglossus. Now we are going to look for the our next. Sir, from the styloid process, the next muscle will take origin from the styloid process and it will get attached to the hyoid bone. What should be the name of this muscle? Stylohyoid. What we are going to look, sir, there is the our muscle stylohyoid. So we are going to observe about the our stylohyoid. So catch this point. Yes, sir. So this our stylohyoid muscle, we are going to talk about our stylohyoid muscle. Sir, it is taking origin from the posterior surface of the styloid process, no? Posterior surface. Okay, sir. Now it is going towards our hyoid bone, where it is getting insertion into the our laser cornu part. Okay, laser cornu part. But remember, when it is reaching to the our laser cornu part, it will bifurcate. Yes, sir. It will bifurcate. Fine. And in between them, later I will teach you, sir, here is the passage for the our posterior belly of the digestive. Okay. Yes. I am trying to find out few beautiful three-dimensional anatomy. Can you observe here? Yes, sir. Look here. Okay, sir. Can you observe this muscle? Yes, sir. Look at this part. Yes. Can you see? This is your styloid process, bony cylindrical projection, and the muscle is taking origin and it is getting insertion into the our hyoid bone. Yes, sir. This is the our hyoid bone. And you can observe, sir, near the our, yes, hyoid bone. Look here, sir, hyoid bone. It is very unique bone of the body, first bone. Why? Because it is having no bony attachment. Okay, it is only single bone of the body which is not having any other bony attachment, no joint with the other bone. MCQ. Parts, three parts. It is having the body, lesser cornum, and the greater cornum. Agree, sir. Fine. Now, catch this point. Sir, it is formed by what? Sir, it is formed by the our pharyngeal arches. So, in pharyngeal apparatus embryology part, I taught it is derived from the our second pharyngeal arch as well as third pharyngeal arch. Complete beta. Okay. Okay, sir. Now, catch this one. Sir, when the muscle is coming from the styloid process and reaching styloid process to the hyoid bone. So near the hyoid bone, can you see it is bifurcating? Yes, 1 and 2. And in between them, there is a gap. Here is a lesser cornu, that is the greater cornu. Yes, this is the greater cornu. Look at my tip of the index finger. And here is the lesser cornu. This is our bifurcated opening. And this is the our what hyoid bone. Okay, sir. Now, look here. Can you observe this muscle? Yes, the beautiful anatomy. Can you observe here? Yes, sir. Look at this part. Yes, with the three-dimensional orientation. Can you see, sir? This is the hyoid bone. Okay, sir. Sir, this is the muscle which is bifurcating. Correct, sir. And here is the our pulley. Beautiful anatomy. Can you see? This is the our one fibrous pulley. Through this fibrous pulley, the muscle is passing. Yes, this is the anterior belly of digastric. Just put the hand in this way. So the thumb is presenting the anterior belly and here is the posterior belly. This muscle is the having two belly. So that's why it is known as the digastric. Di means two, gastric means belly. So this is the anterior belly of the hyoid. Yes, sir. And it is our posterior belly of the hyoid. Correct, sir. And both are attached here. One fibrous pulley just above the hyoid bone. Okay, sir. Now can you see there is a muscle? Yes, sir. So this posterior belly, yes, this posterior belly is intervening. What is the word in the textbook? Intervening. It is intervening in between the lower bifurcated end of the our yes stylohyoid muscle. So just one point for all of you. Yes, sir. You can concentrate, sir. This is our muscle. The labeling for all of you, sir. This is our yes stylohyoid. Okay, sir. So this is the stylohyoid. What are the important points which you have to remember, sir? Origin, insertion, now supply, action. Agree? So what are the different points? Origin, insertion, now supply, action. So I told you this muscle is taking origin from the posterior surface of what? Styloid process. Yes, where it is getting insertion best is the hyoid, but more better, yes, you can say near the laser cornu. Okay, sir. And at lower end it is bifurcated. Fine, correct, sir. Now look here. What is the action? Definitely, sir, this muscle is attached from the above to the hyoid bone. Jidhar muscle, udhar movement. Yes, where muscle goes, there movement flows. So when this muscle will contract, hyoid will go above. So it will cause what action? Sir, it will cause elevation of hyoid and any structure which is attached structures. Now, can you tell me what is the nerve supply? MCQ. Sir, this stylohyoid muscle is derivative of the second pharyngeal arch. Can you comment? Can you comment what is the nerve of the second pharyngeal arch? Yes, yes, yes. Correct, correct word movies. You are right. Can you tell me this stylohyoid? S for stylohyoid, S for second arch. Second arch. Nerve of the second pharyngeal arch, sir, facial nerve. Again, this is the MCQ. Sir, the nerve supply of the styloglossus, 12th cranial nerve. The nerve supply of the stylohyoid muscle is the facial nerve. Agree? Now, look for the next. Yes, sir. Here, we are going to talk about our muscle that will take origin from the styloid process and it will get insertion into the pharynx. What should be the name? Stylopharyngeus. Yes, sir. What is the name? Stylopharyngeus. So just one diagrammatic presentation for all of you. Sir, stylopharyngeus muscle, it arises from the medial surface. So pharynx is at the midline. So it will take origin on the medial surface. So I am presenting with the dotted line, and it is getting insertion into the pharynx. Yes. Yes, in the pharynx. Better to say posterior border of the our thyroid cartilage. There is a one oblique lamina there. Okay, but just one diagrammatic presentation, sir. It is getting insertion into the our pharynx part. Okay, so just one diagrammatic presentation for all of you. So what is the name of this muscle? Yes, sir. Here we are representing the stylopharyngeus. And this dotted line is representing, sir, it is coming from the our medial surface of the styloid process. So what I want to tell you, sir, this is the muscle. Just give the labeling, sir. This is our muscle, stylopharyngeus. Again, what are the important points which you have to remember regarding the stylopharyngeus? So you can say origin, insertion, nerve supply, action. So the few important points which you have to remember: origin. Sir, this stylopharyngeus arises from medial surface of styloid process. Okay, sir. So it is taking origin from the medial surface of the styloid process, also the hyoid bone, but we are not going too much detail. These are the points. Now, where it is getting insertion, so remember it is inserted on the posterior border of the lamina of the thyroid. Okay, but you can remember simply the pharynx. So that stylopharyngeus, better to say posterior lamina of our, you can say the oblique, yes, of lamina of thyroid cartilage. Okay, sir, fine. Otherwise pharynx. So that's stylopharyngeus. We are going to talk about the our, yes, nerve supply. So do you remember embryology integration? Stylopharyngeus is derivative of which arch? Sir, it is derivative of our, yes, third pharyngeal arch. So just tell me beta, what is the nerve of the third pharyngeal arch? Sir, glossopharyngeal nerve. MCQ. Action, sir, where muscle goes, there movement flows. So when it will contract, it will pull the pharynx. So it will cause elevation of the pharynx. Yes, sir, it is our, you can say the elevator. Yes, it will cause elevation of pharynx. Okay, sir. So these are the points which you have to remember. Fine. But there are the ligaments also. So try to catch this point, sir. Ligament. First, we are going to talk about the our stylomandibular ligament. So remember, styloid process to the mandible. Yes, it is on the our medial side. Mandible is on the medial side. Correct, sir? Look here, trying to find out in this our beautiful three-dimensional orientation. Yes, Jarvis, rotate this one. Yes, Jarvis, can you see this ligament? Yes, you can see it is taking attachment. Yes, it is attached between the our styloid process, and here is the our mandible. Can you see along the our medial angle? Yes, angle of the mandible on the medial side. So this is our styloid process to the mandible. So what should be the name? Stylomandibular ligament. Remember beta, this stylomandibular ligament is just thickening of the deep cervical fascia. Okay, sir. Now, can you observe this another ligament? Can you give what should be the name of, what should be the name of this ligament? Sir, this is attached in between the styloid process and to the our hyoid bone. So this is our stylohyoid ligament. Sir, this is the stylohyoid ligament. Okay, so what you have to remember, sir, there is our ligament. Which ligament, sir? Stylomandibular ligament, styloid process to the our mandible. So I'm making dotted line because it is going to the medial side. Fine. So this is the stylomandibular ligament, and one is another, that is the styloid process to the hyoid. So just drawing that another diagram from the our yes tip of the styloid process, it is going to the laser cornu. Yes, fine. So this is what, this is the our styloid to the hyoid bone. So I am mentioning here these ligaments, sir. This is stylo to the mandible, that's why mandibular ligament. Okay, sir. And another one, this one, this is our styloid process to the hyoid, stylohyoid ligament. Getting the point? So in this way, how many structures we had studied till now, sir? First is our, yes, styloglossus. Then we had seen the, yes, the beautiful notes for all of you, stylohyoid. Then we had seen the stylo what, pharyngeus. So these are our, you can say, the three muscles: one, two, three. Why? Here are the our ligaments. Yes, sir. What are the our ligaments? Break the name and think about it, sir. Styloid process to the mandible. So stylomandibular ligament and styloid process to the hyoid. So you will say stylohyoid ligament. Yes, sir. These are our two ligaments. Fine. Getting the point? Yes. So these are the points which you have to remember. Few additional points which we are adding in the same image. Yes. Anatomy means dissection. Dissection means anatomy. We cannot do dissection in our classroom. We can do only in the our, yes, dissection hall. So we are representing that dissection with the help of the image. So you can say anatomy means diagram, diagram means anatomy. So we are adding more information here. Sir, you told that there is the one another muscle, yes, showing with the little bit pinkish color. There is our, yes, anterior belly of the digastric, correct, sir? And the posterior belly of digastric, yes, sir. The posterior belly of digastric is passing in between the our, yes, two ends. Getting the point? Yes. Also, you can see there is the our, yes, fibrous pulley. Again, showing this beautiful one. Imagination. Can you see? Sir, this one. Just look. This is the your anterior belly. Here is the posterior belly. This is our fibrous pulley, and it is located just in front of the laser cornu. Yes, sir. So you can show in this image, sir. Just one diagrammatic presentation. Here we are going to represent that fibrous pulley with the little bit dark color. Just one diagrammatic presentation. Okay, sir. So this is the fibrous pulley. Fine. Now mentioning these structures, additional knowledge: anterior belly of digastric, and this is the posterior belly of digastric. One beautiful knowledge, sir. This anterior belly of digastric is derivative of the first pharyngeal arch. And nerve of the first pharyngeal arch, sir, mandibular nerve. So एंटीरियर बेली ऑफ डाइगेस्ट्रिक इज सप्लाइड बाय, जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. So anterior belly of digastric is derivative of the first pharyngeal arch. Nerve of the first pharyngeal arch is the mandibular nerve. That's why the nerve supply of the anterior belly of digastric, mandibular nerve. MCQ. So we are adding your NEET PG level MCQs, USMLE, PLAB, FMG, whatever, because beta, if your concepts are strong, you can crack any kind of the exam. Now can you see, this is the posterior belly of digastric. Sir, it is derivative of the second pharyngeal arch. Yes, sir. And the nerve of the second pharyngeal arch is the facial nerve. Sir, MCQ, MCQ. That's why what should be the nerve supply of the posterior belly of digastric? Answer is the facial nerve. So you can see again, sir, this digastric muscle is having the double nerve supply. So can you comment? Can you comment? Yes, 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 Doc Saab, thank you, beta, thank you. Mission Need PG 1.5. That was really, I want to say, that was the most lovely class of my life. Okay, especially online class. Okay, because in offline there is a too much fun, enjoyment, too much knowledge. लेकिन ऑनलाइन क्लास बेटा और मुश्किल होती है, लेकिन उसमें जो बच्चों ने साथ दिया, मुझको सारे बच्चों के नाम भी याद हो गए हैं. हमारे उदय भाई थे, उदय कंट्रोल, हमारे मोहित भाई थे, हमारे देवेश भाई थे, है ना. तो ये सारे बच्चों ने आकर जो माहौल बनाया, स्नेहा थी, ब्रह्मज्योत थे, और वहां पर और कितने बढ़िया बढ़िया बच्चे लोग आए, और एक बढ़िया सा जो इन्वायरमेंट क्रिएट हुआ, और जो मिशन 1.5 की एनाटॉमी क्लास हुई, वो लवली क्लास थी. और उसके रील्स आप इंस्टा पे देख रहे हैं. डोंट फॉरगेट टू फॉलो मी एट द इंस्टा एज वेल एज द यूट्यूब चैनल. ओके बेटा, और कोई भी क्वेरी हो आप बिल्कुल पूछ सकते हैं. बहुत अच्छा लगा डॉक्टर साहब कि आप यहाँ पर आए. चलो, ओके सर. सो वी एडेड द मेनी पॉइंट हियर. Now look for the our next thing, few more things. Sir, this is our styloid process. Remember one important relation: the facial nerve will come out through the our mastoid process, and it will run lateral to the styloid process. So this is the our which nerve? Remember, this is the our facial nerve. Also there is our external carotid artery. Remember, the external carotid artery is externally. So external carotid artery is external to the our what? Styloid process. So these are the few important relation: the facial nerve and the our external carotid arteries, these are laterally. So whenever you are performing the surgery at the neck part, remember, there is one nerve from the styloid process and the mastoid process. There is a stylomastoid foramen. The nerve will come out. Yes, it is lateral to the styloid process. Then it is coming towards the parotid gland. It will pierce the posteromedial border of the parotid gland. Then within the parotid gland, it will divide into the two division. Yes, upper and lower. Upper will go towards our zygomatic bone. We will learn in our facial nerve part. So that is the our yes zygomatico facial. Another will go downside. So that is the our yes towards the zygomatico temporal. Okay, yes, that is the faciotemporal, facial nerve towards the temporal side. So faciotemporal. Another is from the our yes facial nerve to the cervical area. So you can say the faciocervical. Also few author will use the different term like the cervicofacial and the our yes zygomaticofacial, fine, temporofacial, this all kind of the words. So then within the parotid gland, these two division will divide finally into the five: zygomatic, yes, temporal, zygomatic, buccal, which will further divide into the upper buccal, lower buccal, then marginal mandibular, then cervical. We know. So these relations are important. Agree? Okay, sir. One more diagram I am going to draw for all of you. Sir, there is, yes, this is the one arrangement. Now I am going to show one another diagram. Now we are going to see this our pharynx part from the transverse section. Okay, sir. So just try to catch these points. Yes, sir. Yes, 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 Asfan. Yes, Asfan, your student from Peshawar, Pakistan. So I want to say thanks not only to the Indian students, but many students from the Pakistan, Nepal, as well as from our Bangladesh. Also the many students from the Georgia, Ukraine, Russia. They all are connected with us. So thank you for your unconditioned love and support. Thank you, beta. Now try to catch this diagrammatic presentation. Sir, we are going to see the mouth oral cavity in transverse view. So our tongue will appear in such kind of the way. Yes, sir. Again, the song dedicated to tongue. तूने मारी एंट्रियां तो दिल में बजी घंटियां रे टंग 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 टंग. Yes, suppose this is a tongue. Behind the tongue, suppose this linear presentation is showing the pharynx. Okay, I am showing here the tongue, and suppose this is pharynx. Okay, sir. Now catch. Sir, suppose this is our mandible. This dotted line is presenting the mandible. Okay, sir. We are making this one as the solid structure. Yes, sir. Suppose this is our mandible. Agree? Now you're looking in transverse section. So on each side, sir, there is a location of what? Sir, our process. Which process? Styloid process. Yes, sir. Suppose it is our what? Styloid process. Yes, sir. These are our right and left styloid process. Okay. Now catch. There is the ligament. Correct, sir. Which is taking origin, which is attached between the styloid process and the mandible. Yes, sir. Can you tell me what should be the name of this ligament between the styloid process and the mandible? Yes. So you have to say about this A. Now I am going to draw one muscle which is taking origin from the styloid process and attached to the tongue on each side of the tongue. So this is the our B. And now you have to say about one more muscle which is attached between the styloid process and the pharynx. So I am indicating this structure as the C. Yes. Can you help me? What is the A? Yes. Good evening. Good evening, Osama, my favorite student. Yes. A. A is the ligament, green color, styloid process to the mandible. So what you will say, sir, this is our ligament. Which ligament? Stylomandibular ligament. Okay. B, from the styloid process to the tongue. So what you will say, sir, this is styloglossus muscle. Yes, sir, it is muscle. And C, styloid process to the pharynx. So what you will say, sir, this is our stylopharyngeus. Again, you will say muscle. Agree, everybody? Fine. Okay, sir. Now catch our few more points one by one. So in exam, you can show these images. Okay, because for the first MBBS exam, you have to crack the exam with the marks, so you can draw this diagrammatic presentation. Okay, now we are going to look for the our more points. Yes, sir. Sir, when you will see, there is the, yes, styloid process, or better to say styloid apparatus we are talking. So in the styloid process, sir, there are the two types of the component, muscles and ligament. Remember, muscles are contractile, so these are also considered as the our adjustable components. Yes, they can contract, but ligaments, sir, they are not contractile. Yes, so what you will say, sir, these are our non adjustable. Yes, these are our non adjustable components. Agree already? Fine. Now what are these muscles? Definitely we all know, sir, stylo. Yes, styloid process to the tongue, so styloglossus. Sir, styloid process to the hyoid, so stylohyoid. Sir, styloid process to the pharynx, so stylopharyngeus. Agree? Fine, sir. Now try to understand this styloglossus, stylohyoid, stylopharyngeus. These all are having origin from the same point, our styloid process, but insertion is different. Getting the point? Yes, sir. So also one very interesting thing, that which are the ligament, sir? Stylo mandibular ligament as well as styloid process to the, yes, hyoid bone. So stylohyoid ligament. Okay, sir. Now you can see this all are taking origin from the one point. Yes, sir. Suppose this is the one point. Okay. And the muscles, it is going to the tongue. It is going to the our hyoid. It is going to the pharynx. Yes. Also there is the ligament to the mandible. Just one simple diagrammatic presentation in this way. So what I want to tell you, there is a one common attachment and diverse kind of the attachment, but these all are attached one at one common point. You know the battle taxi, one very important point, battle taxi. Also you can say the reins of the chariot. Yes, I'm using the another word. Yes. So you all are aware that at time of the Mahabharat, yes, Lord Shri Krishna, I'm just putting here this one. So that we can understand this topic in a very nice way. Catch this point, one very interesting point. Yes, it is written in our textbook also. What? Compare these things here, here. Okay. So catch these points. What I want to say, sir, this is the battle taxi where you can observe there are the many horses. Lord Krishna is handling the many horses, and the all the your reins are attached to the one single part in the hand, but it is having the, yes, diverse attachment. Can you see the here again? Yes, sir. This is the hand, and you can observe घोड़ों के जो लगाम थे वो सिर्फ एक कॉमन पॉइंट पर अटैच थे. यस, इट इज हैविंग सिमिलर काइंड ऑफ द फैशन. There is the one single point and the diverse attachment. So these our steroid apparatus is also considered, yes sir, it is also considered as the our what you can say, sir, these are our homologous, yes, to the, it is also considered as the reins of chariot. Also you can say the battle taxi. Okay, so this is the one very important point. Okay, sir. Also one interesting point, sir, these are our different component in which styloglossus, it is a derivative of, yes, I am writing in a different table, embryological correlation. Yes, sir. We are looking the muscles like our styloglossus. I am writing in short SG. Yes, stylohyoid. Remember muscles, and then stylopharyngeus muscle. So, can you tell me styloglossus was the derivative of which arch, what structure? So, your answer is occipital. Somites also you can say, more specifically myotomes. MCQ. While the stylohyoid muscle, sir, it is derivative of the second pharyngeal arch. Stylopharyngeus, sir, it was derivative of the third pharyngeal arch. And in the similar way, the ligaments, sir, the ligament was our stylomandibular, stylomandibular ligament. Actually, it is the derivative from the deep cervical fascia. It is the thickening of the deep cervical fascia. And in the similar way, there is the our stylohyoid ligament. Sir, stylohyoid ligament, it was the derivative of the skeletal derivative of the second pharyngeal arch. Yes, Richard's cartilage. So again, you will indicate the second pharyngeal arch. So you can say that, sir, these our different structures are having the same attachment, but these are derived from the our different components. Getting the point? Okay. So these are the your important things. Yes, steroid process is common, but each muscle ligaments, they are coming from the different arches, pharyngeal arches of the body. Okay. So now we are going to talk about our Eagles syndrome. Yes, sir. We are going to talk about our clinical, that is the Eagles syndrome. Yes, as we had used the image already. Again, I am adding the different images for all of you. Yes, sir. One image. Otherwise, we had used these images at the beginning. So can you see? This is our, yes, excessive elongated styloid process. Correct, sir? It causes compression of the nearby structure. Yes, it causes of nearby structures. Yes, sir. What are the different nearby structures? Sir, here is the our, yes, you can say the common carotid artery, internal carotid, yes, external carotid. Yes, it is in between the external and internal carotid artery. There are the different cranial nerves in the neck. Yes, internal jugular vein. So these all structures are compressed by this excessive elongated styloid process, which gives the many kind of the neck symptoms. That situation is our, yes, Eagles syndrome. Okay, I am trying to find out few more images for all of you. Can you see this beautiful image? Yes, look here. You can observe this structure. Sir, here is the our mandible. Agree? Sir, this is the mastoid process and this is the styloid process. Correct, sir. You can observe the artery. Sir, here is our common carotid artery. Yes, it is dividing into the external carotid artery. Correct, sir. And it is going inside. So this is the internal carotid artery. You can observe the internal jugular vein, and in between them you can see, sir, this is the vagus nerve. Yes, vagus nerve. Fine. So can you observe? This is your, yes, elongated styloid process. This is the one very important point, that it is present between the external carotid artery and internal carotid artery. This is the one very important Viva question. What are the different structures passing between the external and internal carotid artery? Okay, fine. Among which them the styloid process as well as the different attached structures, you can say. And there is our vagus nerve. Yes, this is the internal jugular vein and this is our 10th cranial nerve. So definitely when there is the enlargement of this our styloid process, there will be the compression of this nearby structure. This is, yes, your Eagles syndrome. Agree everybody? Yes, Osama, you are right, beta, you are right. Fine. So these are the our different things regarding this topic. Okay. So thank you very much. Please ask if in doubt. Hope you all got this point. These styloid apparatus, this is important MCQ as well as your short note during the first MBBS. Also remember, it is the favorite question for the Viva because it is having the integration with the your embryology. Okay, so please ask if any doubt. Any doubt, please ask. Hope you all enjoyed the today's session. Okay, so summary, what is the our steroid apparatus? Yes, it is important topic because of the clinical. So one quick summary for all of you. Look here, at the end of the day, at time of exam, what you have to remember, steroid process plus attached structures known as steroid apparatus. Okay, sir. Total 5 structures are attached. Fine, sir. 3 muscles and 2 ligaments. What are the 3 muscles? How you have to remember? Styloglossus, stylohyoid, stylopharyngeus. What are the 2 ligaments? Yes, styloid process to the hyoid, stylohyoid, and styloid process to the mandible, stylomandibular ligament. Okay, sir. After that, what you have to do? Diagram practice. Yes, you have to draw the tongue, then hyoid, then pharynx. So muscles, styloglossus, stylohyoid muscle, stylopharyngeus. Okay, ligament, stylomandibular ligament and stylohyoid ligament. Okay, sir. Now another diagrammatic presentation, transverse section. You have to draw the tongue, pharynx. Here are the 2 dots presenting the styloid process, and that is the mandible. So ligament, styloid process to the mandible, stylomandibular ligament, styloid process to the tongue, styloglossus muscle, and styloid process to the pharynx, stylopharyngeus muscle. Simple. Diagram will give you the marks. Okay. Now after that, yes, few additional point. There are the 2 types of the component, adjustable and non-adjustable. Adjustable, which are showing the contraction. So muscles are under the our adjustable component, while the non-adjustable, which are ligament, so stylomandibular and stylohyoid ligament, and these are having the one common attachment and diverse origin. Fine, so there are the different points where they are showing the attachment, but they are attached to the single point styloid process. Okay, so it is just looking like the our reins of the chariot. जैसे भगवान श्री कृष्ण जब रथ चलाते हैं तो घोड़ों से रस्सियां आती है और उनके हाथ में थमी हुई होती है. So this is our what reins of the chariot appearance. Okay, so these are the points, and then you have to remember one beautiful embryology integration, styloglossus muscle. Sir, in embryology I told you it is derivative of the our occipital area myotome. These are migrating within the tongue and making the our tongue muscles except palatoglossus. So yes, that's why it is supplied by the nerve of the occipital myotome, 12th cranial nerve. Stylohyoid muscle, yes, stylohyoid muscle, it is S for stylohyoid, S for second pharyngeal arch, S for stylohyoid ligament, second pharyngeal arch. Both are second pharyngeal arch derivative. Okay, so what should be the nerve of the muscle? Remember, not the ligament. Ligaments, they are not supplied by the nerve. Yes, stylohyoid muscle, yes, it is supplied by the nerve of the second arch, that is the facial nerve. Stylopharyngeus muscle, third pharyngeal arch, so nerve of the third pharyngeal arch, glossopharyngeal nerve. And last is the your stylomandibular ligament, it is derivative of the deep cervical fascia, and stylohyoid ligament, that is second pharyngeal arch. You have to remember this one clinical Eagles syndrome, it is very important for the clinical, and neck surgery, the different relation. Okay, so hope you all got the point. So thank you very much, God bless you all. So again, सिर्फ हंगामा खड़ा करना हमारा मकसद नहीं, कोशिश है कि सूरत बदलनी चाहिए, हमारे सीने में नहीं, तुम्हारे सीने में ही सही, कहीं भी हो आग, लेकिन आग जलनी चाहिए, ये आग जलनी चाहिए, ये आग जलनी चाहिए. All the best, dear students. God bless you all. Again, we will meet soon. Okay, so please share this. All are the very free content and very important content. You can watch anytime and you can gain the knowledge. All the best, beta. God bless you all.